今日はよろしくお願いします。
お願いします。
で、まず、脊柱管狭窄症に対する、フローレンス法の、特徴について教えてください。
The Florentine method is a new method very interesting in the treatment of spinal stenosis from the degenerative origin because it is allowing us to treat the older patient without requiring open surgery. Open surgery is really efficient, but the problem is that most of patients are not eligible due to aging condition and contraindication to anesthetic. The Florentine method is can undergo under deep sedation during only 30 minutes in prone position. So it is the most of patients are eligible to that method that is very efficient.
Yeah. Thank you. で、今度は Q フローレンス法なんですが、すべり症や、椎間板の不安定に対する、適応に関して教えてください。
It's the same for the Q Florence method because it allows us to treat older patients that are not eligible to open surgery, to treat instability, antelesthesis from a degenerative origin without requiring open surgery and long operating time under general anesthesia. So that point means it's the main interest of the Q fusion method. Q Florence.
Q Florence.
Sorry.
Thank you. 先生のご経験の中で、すべり症が改善したっていう症例について教えてください。
Oh yes, but it occurs on a daily practice, because the patient with instability and antelesthesis are very frequent patients in our daily practice, and because the Q Florence method allows us to treat most of the patients, it becomes like a routine, and we see a lot of patients that are unable to. I remember a special patient he told me that he was unable to walk from the kitchen to the bin when he was cooking, So afterwards he was able to walk around and to do his groceries by himself, So without any pain.
今度は、Q フローレンス法が、適用とはならない状態や、疾患に関して教えてください。
Yes. The contraindication are mainly the infected patients, the hemorrhagic condition, post-traumatic disorder of the spine, and tumor condition of the spine. And of course, our clinical examination in the preoperative period must exclude psychiatric patients. But all the other patients can undergo that method.
じゃあ今度は固定術と Q フローレンス法のそれぞれのメリット、デメリットについて教えてください。
Okay. The main advantage, as I said before, the main advantage of the Q Florence method is the non-anesthesiologic contraindication that allows us to treat a larger amount of patients, of course, because the intervention is so short. It's about 30 minutes. Another advantage of the Q Florence method is that if it's not efficient, then you can remove the device by yourself without any surgical intervention. And then it's possible for a surgeon to undergo and to plan the open surgical method, traditional method.
それでは今度は、世の中には、様々な椎間板の治療、PRP 法とかいろいろありますが、そういったもので、脊柱管狭窄症に対して、改善するかというと難しいと僕は考えています。で、ただそこでフローレンス法などの治療がすごく役立つと考えているんですが、いかがでしょうか
So the spinal stenosis, it's a mechanical condition, and the fact to treat the disc is not going to repair the mechanical condition. If you want to treat the cause, then you have to have mechanical action to reopen the canal dimension, and lobster Q fusion and Florentine method are able to do that, but not the intradiscal treatment alone.
まあ僕らセルゲル法を多くやってますが、そのセルゲル法とフローレンスも両方やりましょうという例もあると思うんですが、それについてはいかがでしょうか。
For example, some patients, they have a disc hernia because of instability. And then it is very convenient to be able to treat both the disc hernia with disco gel, cell gel, and instability with the device Q fluorence, both at the same time under mild sedation.
あとは、フローレンス法とか、Qフローレンス法、それらをやった後の、術後の痛みなどについては、いかがでしょうか。
Okay. The expected pain can be relatively high during the first hours and necessitate a follow-up, a close follow-up from the team. And this pain can be usually well controlled by use of NSAID and acetaminophen. And during the next days, the patient must expect pain around 4 out of 10 during the 6th first day, for example. But afterwards, it's going to progressively decrease.
それではそれらの治療の症状の改善っていうのはどういうスピード感で改善していくんでしょうか。
The clinical results after the implantation of a stabilization device or a Q method device for spinal stenosis are expected during the first weeks. I'd say during the 3rd or 4th weeks after the implantation. But it's progressive.
治療の合併症については、どんな印象をお持ちですか？
Okay, so the complication, the expected complication are exactly the same as for surgery, but in a lower range. The main complication that we fear is infection, of course, because if you have infection of an implanted device, then you have to remove the device. But as for surgery, hemorrhage can occur during the intervention, and the device is not supposed to be dangerous for the nerve root because we only intervene on the posterior part of the spine. That is only the bony part of the spine and not the nervous part of the spine. So it's much safer like this.
フローレンス法や Q フローレンス法の治療の後、動きの制限、運動の制限などはどうお考えですか？
Okay, I recommend a 2 weeks period after the intervention with the wear of a corset. Okay, and I used to say to my patient the two following limitations: no bending forward and no lifting. This is very important, especially during the first 2 weeks. But I say it's better to be cautious during the first months, especially for the sports re-entry and work activity.
そういったスポーツが好きな患者さんってすごく多いんですけど、そういったアクティビティっていうのはいつ頃からどれぐらいやっていいのか。
Depending on their favorite sports, the delay may vary. Okay, but as soon as the first month, For the lighter sports and for sports that involve lifting, I would say 3 months.
Okay.
But we have patients that can go skiing, baseball, golf, no problem.
OK。あとは先生の中で印象的な治療前と治療後で非常にすごく良くなった、そういった患者さんっていらっしゃいますか？
Yes, most of the patients have big changes because we are intended to treat severe patients. We are not going to treat patients who are not severely debilitating by the disease, because we have to understand that most of the patients we used to treat, they have already undergo physiotherapy, lots of medication, and lots of chiropractic, and sometimes disc injection, and all this has not been effective. So these patients are in a serious condition. So it's always a good result after stabilization of the spine by the Q Florence method. Sometimes it can be really interesting to be able to treat both the disc and the instability at the same time. In Europe, we have several colleagues that do it on a regular basis. They do like that. They inject cell gel inside the disc, and in the same intervention, they stabilize the segment with the implantation of a Q Florence device. Very interesting option.
Yeah.
It is a good option because then you will act both on the anterior part of the intervertebral space and by blocking the posterior part. So you act chemically on the disc and you act mechanically on the posterior part of the spine in the single intervention.
実際に診療の場で患者さんに入れるものを見せたときにびっくりされる患者さん多いんですが、先生のところではいかがでしょうか？
I used to explain them that the device is not so big and the size is adapted to their own spine. That's the first thing I say. Second point, we have to compare this device to the device that would be used by a surgeon. And surgeons, they have to fix 3 levels each time because they anchor to the upper level and then to the lower level compared to those levels that need to be stabilized means that they have to put material in 3 levels, whereas we have only 1 level treated. So this must be reassuring for these patients.